Hi, welcome back to LPHumananatomika. In this session, the fourth part of anatomical terminologies, I will be discussing on general clinical terminologies. If you have not watched the previous three parts of anatomical terminologies, please go back and watch them. Okay. Are you aware of how many general clinical terminologies are there and how they are used and applied in relation to a particular part of the body? Let us check some of them in this session. The learning outcomes of this session are: understand the general terms used in clinical anatomy, what suffixes are used in different diseases, and what are the different terminologies used in clinical anatomy. So, coming to the suffixes, the suffix itis means inflammation. So when you attach this itis, okay, to the affected part of the body, okay, we come to know that there is inflammation in that particular part of the body. For example, appendicitis. That means there is inflammation in the appendix. So the same way, other examples which I can give you is tonsillitis, arthritis, neuritis, dermatitis. Okay. So the next suffix which can be used like that. So this applies for the rest of the suffixes. Okay. So ectomy means removal from the body. So example for ectomy is appendicectomy. So you remove the appendix from the body. Okay. Complete removal of the appendix. So the other parts of the body, okay, some of the examples, okay, I can give is tonsillectomy, gastrectomy, nephrectomy. Okay, these are some of them. So the suffix otomy means open and close hollow organ. Okay, so for example, laparotomy, hysterotomy, cystotomy, cystolithotomy. The suffix ostomy means to open hollow organ and leave it open. Okay. So for example, cystostomy, colostomy, tracheostomy. Okay, so these are some of the example for ostomy. The suffix oma means tumor. So how this can be used for a particular part of the body is lipoma, osteoma, neurofibroma, hemangioma, carcinoma. So all these are applied terminologies for oma for a particular part of the body. So coming to the other general clinical terminologies, okay, puberty, the age at which the secondary sexual characters will develop. Okay, so this is the age, okay, particularly where secondary sexual characters will develop in an individual. So the what is the age in girls, okay, is 12 to 15 years and 13 to 16 years in boys. What do you mean by symptoms? Okay, they are subjective complaints of the patient about the disease. Signs or physical signs, they are objective findings of the doctor on the patient. Diagnosis, it means identification of a disease or determination of the nature of a disease. Prognosis means forecasting the probable course and ultimate outcome of a disease. Pyrexia means fever. Lesion, injury or a circumscribed pathologic change in the tissues. Inflammation is the local reaction of the tissues to an injury or an abnormal stimulation caused by a physical, chemical, or biological agent. It is characterized by swelling, pain, redness, warmth or heat, loss of function. Okay. Edema means swelling due to accumulation of fluid in the extracellular space. Thrombosis can be defined as intravascular coagulation or solidification of blood. Embolism can be defined as occlusion of a vessel by detached and circulating thrombus or embolus. Hemorrhage is the bleeding which may be external or internal. Okay, so that will be a continuous bleeding. It can be inside the body or on the surface of the body. Ulcer is a localized breach or gap or erosion in the surface continuity of the skin or mucous membrane. Okay, that is inside the hollow organs. Sinus is a blind tract open at one end lined by epithelium. Fistula. It is an abnormal passage usually between two internal organs or organ to surface of the body and lined by epithelium. Necrosis is a local death of a tissue or organ due to irreversible damage to the nucleus of the cells in that particular part of the body. Degeneration is defined as a retrogressive change causing deterioration in the structural and functional qualities. It is a reversible process but end in necrosis if it is not treated properly. Gangrene is a form of necrosis combined with putrefaction. Infarction is the death or necrosis of a tissue due to sudden obstruction of its artery of supply, okay, which will be usually an end artery. Atrophy is the diminution in the size of cells, tissue or organ or a part due to loss of its nutrition. Dystrophy can be defined as diminution in the size due to defective nutrition. Hypertrophy, it increases the size without any increase in the number of cells. Okay, so if we take any particular cell in the body, okay, that cell size, if it increases without the increase in the number of cells, we call it as hypertrophy. Hyperplasia, it is the increase in the size due to increase in the number of cells. That means that particular part of the body increases in size because of the number of cells and not because of the size. Okay. Hypoplasia, incomplete development of that particular part of the body. Aplasia is the failure of development of the particular part of the body. Syndrome is a group of diverse symptoms and signs constituting together the picture of a disease. Paralysis is the loss of motor power or the movement of a part of body due to denervation or primary disease of the muscles. Hemiplegia, it is the paralysis of one half of the body. Paralysis, okay, paralysis we have discussed. Okay, paraplegia, it is the paralysis of both lower limbs. Quadriplegia is a paralysis of all the four limbs. Okay, so paraplegia, quadriplegia are part of the paralysis. Anesthesia, it is the loss of sensation. Okay, analgesia is the loss of pain sensibility. Thermanesthesia is the loss of the temperature sensibility, okay, of the particular part of the body. Hyperesthesia, abnormally increased sensibility. Okay. So paresthesia is the perverted feeling of sensations in the body. Coma is deep unconsciousness of the individual. Okay, complete unconsciousness of that person. We call it as coma. Humor, it is also called as neoplasm. Okay, it is defined as circumscribed, non-inflammatory, abnormal growth arising from the body tissues. Benign is the mild illness or growth which does not endanger life of a particular person. Malignant, it is the severe form of illness or growth which is resistant to treatment. Okay. Carcinoma is the malignant growth arising from the epithelium. It can be ectoderm or endoderm. Sarcoma is the malignant growth arising from connective tissue, that is in the mesoderm. Cancer, a general term used to indicate any malignant neoplasm which shows invasiveness and results in death of the patient if not properly treated. Metastasis is defined as the spread of a local disease like the cancer cells to distant parts of the body. Convalescence is the recovery period between the end of a disease and restoration to complete health. Therapy is the process of treatment of any particular disease. Okay, so that is some of the general clinical terminologies, whatever we have discussed until now. Okay, so we will check the summary part in the next session of anatomical terminologies, which will be the 5th part. So share your lessons learned, okay, whatever you have learned and what you can recall from this general clinical anatomy terminologies. Okay, share it in the comment box below. Thank you. If you like the video, hit the like button. If you have not yet subscribed, subscribe to the channel and hit notification button. Join my private Facebook community where like-minded students will support, discuss, encourage and push each other towards reaching the goal. For link, visit the description area. Thank you for watching.